Okay, well, I think that I can see that many of the attendees have joined us, so I think we'll get started and let other people join us as and when they do. So welcome everyone to this session. This is the second of the volunteering sessions within the Times Like These conference. My name is Ellis Paine. I'm a co-chair of the Voluntary Sector Studies Network and research fellow at the Third Sector Research Centre at the University of Birmingham. Great to be with you all today. Thank you to our speakers for joining us, and thank you to those of you who are in the audience for joining us as well. So as I said, this is the second of the two sessions specifically looking at volunteering. Fantastic. I can see that Geoff, the final of our speakers, is now here. We've been having a few technical issues this morning, but hopefully all will go smoothly. So yeah, this is the second of the volunteering sessions, whereas the first one focused particularly on the mobilisation of volunteers, although the discussion became much more broad. This second session is focusing more on the experience of volunteering during COVID and beyond. We've got 5 excellent presentations to look forward to throughout the session, drawing on different perspectives and different ways of thinking and researching volunteering in different locations. So I'm really looking forward to the session. We are going to be tight for timing, so I'm not going to say much more. What we're going to do is we're going to take each of the 5 presentations in turn. We'll stop after each one if there's any very brief questions for clarification, but overall we hope that we'll kind of hold the questions and discussions for time at the end, or we can have kind of discussion across the panel as a whole. In terms of how we hope that the question and answers and chat function will work, so alongside myself is my colleague Véronique from NCVO.
Hello everybody.
Hi Véronique. So I'm going to chair the session, but Véronique is going to facilitate the session, and what that means is that Véronique is going to be there looking after the chat function and the Q&A function and responding to points, and particularly taking out questions which are raised and translating them and addressing them to the speakers. So as attendees, if you can use the chat function to say hello to each other, to chat, to share information, share resources, that kind of thing on the chat function. But if you've got questions for the speakers, for the panel, if you could please put those in the Q&A function, then Véronique will take them from the Q&A function and use those to pose questions to the panel. And that's the way that we're kind of hoping to work it. So if we can try and stick to that, it would be fantastic. A reminder that the session is being recorded, so it will be available for you to kind of look at your leisure afterwards through the VSSN website, so do keep an eye open for that. But I think that's more than enough from me. So now I'm very pleased to turn over to our first speaker. So first we've got Jurgen Grotz from the Institute for Volunteering Research at the University of East Anglia. And Jurgen is going to talk to us about the experience of older people volunteering or not volunteering during COVID. So over to you, Jurgen. Thank you.
Thank you very much, Angela. Let me just share my screen and trust that is playing. Well, it's still good morning. Good morning, everyone. When I last looked before I put this on screen, there was about 70 or more of you out there. That's lovely. I've been coming to these conferences for well over a decade. If I remember correctly, the first one was in 2007 in Warwick, when I spoke about the symposium that went completely wrong. I hope that's not going to be the same today. But in all these years, I was able to see the people in the room. As I'm not able to do that today, I would like you to ask you to do me a favor. Why don't you say hello in the chat box? It says who you are usually, and if you want to add something to it as well, just so that I know who's out there, and that would be really nice, and I would appreciate it. That would be lovely. Thank you. Well, I'm Jurgen Grotz. I'm the director of the Institute for Volunteering Research, known to many as IVR. At IVR, what we do is, in the name, we do volunteering research. And so today, I will speak about what we're finding out about the effects of the pandemic, and in particular, the effects about pandemic policy making on older volunteers. But before I start, and building on what Angela said about using the chat box, I will tell you a bit more about my methodology later on, but I'd like you to be part of it. If you know of any publicly available online documents which may contain information about older volunteers during the pandemic, please put a link into the chat. If you put it in the chat, other researchers can use the same methodology as I will. If you send it to me later directly, I will also try and make the entire data set available. I will tell you later what I'm going to do with that information. And just to say, why is it earlier on in the plenary, Anna said that she knew that older volunteers were feeling excluded, but then I asked, what sort of documents do you have? And she said, no, unfortunately, it's all anecdotal. So as much as I can, I would like to find some documents. So please, if you have, do send me links. I will tell you what I'm going to do with them. Because we need evidence. Now, evidence is a bit tricky, and the pandemic has made clear to me our responsibility not just to keep and analyze the research that we're doing and the research that others are doing, but to keep and analyze public records. You will see why that is. You will also hopefully have seen that between Angela and Véronique, who are here on the call, but also Findlay and Fiona, who are here on the call as well. We did some work on evidence. It's the Volunteering and COVID-19 Evidence Group. And if you want to have a look at what we did, you can find it both on the IVR and the VSSN website. And on the VSSN website, you will also find the repository of research that's currently happening. So that's the research side, and that's really important. But public record was a lot more tricky. And the effects of not having a handle on it can also be very tricky. I was perplexed when, in a conversation with somebody working in Whitehall, they suggested that, well, it was entirely up to volunteers in March whether or not they stopped volunteering or not. And so I had to point out to them the evidence that in a televised note, the Prime Minister first, on the 16th of March, said, everyone stop non-essential contact. Not even a week later, he said, stay at home. And I quote, to protect our NHS and save lives. And then I, like many of you, will have got a letter telling me I must stay at home. A letter by the Prime Minister. Now, I had that to hand because I was actually making a submission to the House of Lords Select Committee on Public Services. And I also told them that we currently estimate that there's about 5 million over 65s who have been regularly volunteering. Question is, why is that particular part important? Now, Lord O'Donnell in 2014, and he's still telling us a lot of things, but in 2014, he told us that pensioners who do not volunteer reduce their life expectancy. In fact, the Telegraph then turned that into, quote, not volunteering was the equivalent of taking up a 15 cigarettes a day habit on the day you retire. It took a little bit of digging, but this goes back to a meta-analysis in 2010 by Holt Lundstad, Smith and Leighton on the relationship, on social relationships and mortality risk. And I forgive, I had to look on my notes there for that. Furthermore, we do know that volunteering for people in older age is more strongly linked to well-being in older age groups. And if you want to look for evidence on that, chapter 52 in the Smith-Stebbins Grotz terribly big handbook, but it's Wilson who did a lot of work on that. And finally, when you take those two things together, one, volunteering is good for you, especially if you're an older person, and stopping to volunteer is really bad for you if you're an older person. That makes the announcement of the Prime Minister in March a public health issue for 5 million people. So I mentioned the submission that I did to the select committee, and that brings me back to evidence. So what sort of evidence can I actually use? Now, the select committee kindly actually published not just my submission, but also the 82 other submissions. And so what I did swiftly, I downloaded them all, I uploaded them in NCVO, and I did a frequency search, which highlighted that in the 82 submissions, there was only very few that even mentioned older people, and only one that spoke at length about older people, but they didn't mention older volunteers. So that was Age UK, in fact, that was the submission. And everybody has access to that, but we need to start using that evidence. And that is why I'm calling on you to send me more, because, and here comes the trick, I will try to find everything you send me, download it, get it into NCVO, do a frequency search that helps identify key terms and issues that we might be wanting to explore further in a thematic analysis. Because the key part, the issue that we are facing, and it's great to have this conference, because yesterday I was hearing a number of things. One, there's research on volunteering going on that isn't bothered or isn't currently concerned about the people who stopped volunteering. That's fair enough, they have their focus. There's anecdotal evidence that suggests that older volunteers have switched to other forms of volunteering, telephone, befriending, that sort of thing. And that chimes with some of the research that we saw from Sport England, which said, you know, forms of volunteering shifted, or we don't know so much about the age range there. But the key part is there seems to be conflicting evidence, because it stands directly opposed to other evidence that I found where volunteer managers speak of their volunteers that are struggling with isolation and lack of purpose. And if I add to that the anecdotal evidence that Anna mentioned this morning of people feeling excluded, and I think that's, you know, it's worth how many? 2 minutes?
1 minute, 2 minutes.
I forgot to switch the thing on. Okay, why is this important? Because the only ones who sent evidence to the select committee, they're closing their branches because they have to. Now we know that other organizations are folding as well, but here we're speaking specifically at the experience of older volunteers, and if that voice disappears at the moment in the policy making, it's not being heard. So how did I choose the title for today? This is a tweet from a volunteer manager in April. And it speaks very, very clearly about the sort of need to support, or the need to listen to the older volunteers and their experiences in having to stop volunteering. And I would suggest that, given how severely this the loss seems to affect them, that policymakers at the moment are not sufficiently considering this older people loss of volunteering opportunities as a public health issue, as an equality issue, and importantly, because this isn't going to be the last time, as a pandemic policy planning issue. And I think that's a very poor return on the contribution that older volunteers have already made to this society. And I'm sorry if I overran.
That's brilliant. Thank you very much, Jurgen. I think a really important reminder that while a lot of the focus during the pandemic has been on the kind of an apparent, what people are talking about as a kind of surge of people volunteering, a really important reminder that lots of people have had to stop volunteering, or other people have shifted their volunteering. So thank you very much for that. And I can already see some kind of comments, and people are responding to your request for information in the chat box. So do have a look at that when we move on. I think I don't think there's any quick questions for clarification in the Q&A. So for now, we'll move straight on to our second speaker. But do start to put in questions into the Q&A for any of the speakers as we go through. You can start populating that now as we go. But our next set of speakers from the University of Sheffield and University of Northumbria and Glasgow, Caledonian, Geoff Nichols is going to lead the presentation. But there's Fiona and Lindsay are both here as well. But Geoff, do you want to share your screen and get that going while I just introduce you? So Geoff and colleagues are going to talk about the response of volunteers in sports during COVID. So
okay, thank you. Yeah. Right. Get that right. Right, slideshow from beginning. Okay, yeah, as an older person, I do need assistance with the technology sometimes. So here we go. I think I've got it. I've got my two co-people here, Lindsay and Fiona here as my minders, just in case I mess it up totally. So it's been really interesting listening to some of the presentations on the conference so far, making links between that and what we've done, really. So we've been looking at community sports clubs' response to COVID situation. We're interested in how they adapt to the delivery of sport, the organisation of the club. Can they take advantage of new opportunities offered by the COVID-19 situation, and are they sustainable as well? So my two colleagues are Lindsay Findlay-King from the University of Northumbria, who's with us today, and Fiona Reid, who's also with us today. All right, moving on then. So community sports clubs are classic mutual aid organisations in that our research covered Scotland and England, but in England there's about 72,000 of these, and they average about 100 adult participants, 77 juniors, 44 non-playing members who are supporting the organisation, and 24 volunteers. Now obviously that's as best as we can estimate, but it gives you a pretty good idea. And Scotland, the figures are pretty much the same in terms of the number of volunteers and their role in running the clubs. So the clubs are managed and delivered almost entirely by volunteers, and they're a very important area of formal volunteering. When we look at statistics on volunteering, we can find that sport activities come out very strongly in terms of an area of formal volunteering. So this network of voluntary sports clubs are very important. We hypothesised that there were going to be some differences between clubs. We hypothesised that there would be difference between clubs whose sport was indoors or outdoors, because it would be easier for people to take part in the activity outdoors. We hypothesised that there'd be a difference between if they owned their own facility or they hired or leased it, because of the implications of fixed costs of having their own facility, maintenance, rent and so forth. And also there'd be a difference between contact sports and non-contact sports, again in their ability to go back to playing sport. And we found that all of these did make a difference to clubs' responses, really. So what we did structured interviews with 13 clubs, and we selected our sample to give a range between these differences between different types of clubs to test if they did really make a difference. And our clubs were interviewed in July and August. Each interview was about an hour long, and we recorded it, and then we transcribed it and analysed it by looking at themes that were emerging from the interviews. Some we anticipated and some we didn't. And about half the sample was in Scotland and about half the sample was in England. So first looking at the effect on the volunteers then, I think the first thing to note is that volunteers have got a huge pool of what we might call social volunteering capital, in that they're very committed to the club, they're very committed to the organisations with the club is a social organisation, and they're committed to their sport. So all the volunteers are very keen to keep the club running, to get it going as soon as possible. All the clubs had to close down immediately when the original restrictions came in, but were very keen to try and get the club going as soon as possible. During the immediate lockdown, they had extra tasks of maintaining the buildings, running Zoom meetings and learning how to do that with their committees, contacting members to keep them in touch with what's going on, and plenty of work to do in terms of planning reopening of the club and the facility. They had to think about how they were going to adapt the sport and the facility, and each one was different, as we'll see in a little bit. They had to keep in touch with the members because the social rewards of membership and the club as a social organisation is really important. And they had to do that with different ways with different members as well. So some members wouldn't look at emails, they wouldn't look at Facebook. the older members particularly, they had to phone up and make an effort to get in touch with them personally. One of the difficulties that clubs had was, in terms of reopening, they followed guidelines that were presented by their national governing bodies of sport. And these required interpreting, and these often changed at short notice. And in turn, the national governing bodies of sport had to check them out with Sport England or Sport Scotland. One of the major difficulties for the club was really the loss of income. They could lose income from, if they had a facility, the ability to hire it out, and they might be concerned about losing income from members. But that really depends on the seasonality of the sport, how that coincided with the lockdown. They've got the same maintenance costs, but generally, financially, the clubs, with some exceptions, felt they were sustainable at the moment. The big difference, and this was interesting in terms of John Mohan's presentation, was if they had fixed costs of maintaining a facility. So here's an example of a tennis club showing some of these things. A quote from a tennis club respondent said, where changes were presented to volunteers, a lot of work in a little bit of time. We had to unpadlock the gates, make notices, set out the booking system because we had to follow Lawn Tennis Association guidelines. You've got to really go through them and find out all the work. Then the rules changed overnight. Then we had to do something else, right? So basically this is illustrating the fact that these volunteers had to react very quickly because they wanted to keep the club going, changes in guidelines from their governing body, which kept on coming at them. So they're enthusiastic, but they react to this all the time. So what about the effect on the clubs then? So while it's possible to generalise about the effect on the volunteers running the clubs did in fact prove to be quite different. So it's difficult to generalise about that. The clubs were operated indoors. It was much harder to adapt the sport. For example, something like squash, when people are close to each other, or badminton, it's harder to reduce the numbers of participants so they're not as close to each other. They might think about changing the rules, so the squash club thought about just playing on one side of the court, alternatively players. Things like gymnastics had to adapt the sport, so there's fewer people involved, they clean the equipment more often and so forth. Outdoor sports, on the other hand, like hill walking, it was easy to keep going in little groups in an informal way because they didn't have to adapt anything. And then clubs that had their own facility, they might experience a severe loss of income from renting it out. They might experience a big loss of income from users, less people using it, more cost of adapting it, and they might have same or greater maintenance costs. So they were in a more difficult financial position. If clubs didn't have their own facility, they didn't have any of these costs, but they did have to rely on facility availability. So something like a badminton club would have to rely on local authority facilities becoming available when they did, which in England was about the 25th of July, so they couldn't do anything till then. Or if they were hiring a sports ground, like a hockey club, depending when it is available. And in terms of the contact and non-contact sport, again, there was a difference. As anticipated, the contact sports, people had to adapt it more. For example, rugby had to be adapted to a sort of non-contact type, so you take the scrum out, which might not be the same thing, really. I don't do rugby, but people might not enjoy doing rugby without a scrum and all that stuff, so it might affect members because they might not want to do it. Non-contact sports, like going walking, no problem, really. And one of the themes that came out of our research, which we hadn't really thought about before, which was interesting, but cuts really across all of the discussions we've had, is different perceptions of risk and how that affects what people do. And risk is actually subjective, it's not objective. So individuals have got different perceptions of risks, and then clubs collectively have got different perceptions of risk. And then national governing bodies have got to interpret government guidelines in terms of covering the risk satisfactorily. Right. So this quote from a yachting club representative illustrates this. This yachting club had decided to go back to participating, and you're going to have 2 people in a boat, maybe someone in a safety boat and so forth. And this guy says, well, I'm not going to be going out on a yacht this year because that's my personal view of the risks involved to me. Until we get a vaccine, it's not worth doing it. I'm just going to keep my head down. Right? So this guy has been sailing single-handed. He's been going out by himself, but he doesn't want to take part in the club activities with other people, arriving there with other people, sailing with other people in the boat and so forth. So that illustrates that at one level, the level of risk is perceived subjective by the individual. Some individuals want to go back to sport and some won't. And clubs have got to adapt to that. There were limits to what the volunteers can do. The aim of the volunteers was just to get back to normal, wherever that was, as close as possible. But so we read Rob Macmillan's article about suggesting there was a possibility for voluntary organisations to rethink what they're doing and maybe link to all these 3,500 COVID support groups or new health and mental health, physical mental health agenda. But clubs haven't got the capacity to do that. They've only got the capacity to try and get back to what they were doing so far. So
1 minute, Geoff. 1 minute.
Okay.
Please.
So the issue is, can the volunteer clubs actually transform and do something a little bit different to adapt, or what help they need, or do they just do what they're doing before? And then the big issues really, I'll go back again, the big issues really, can this network of clubs survive as a valuable resource, providing health and social benefits? Do they justify the same support as pubs, for example? Do we need to think of them as a valuable community resource with a preservation value? And further, can this type of organisation take a bigger and different role in meeting society's needs? Which is the big question that I'm really sad about with this whole pandemic, is that it's not the opportunity to step back and say, what can we do about climate change? What can we do about poverty? What can we do about inequality? All these issues have been highlighted, but as a society, we don't seem to have the capacity to go back and say, what sort of society do we want? And therefore, how is the voluntary sector going to contribute to it? So just one last slide. These are the references we've used. We've actually written up our report, and it's just about to appear on these two websites at the top. So if you want to have a look at it, you could have a look at it there. Right, thanks very much for your time.
Brilliant. Thank you very much, Geoff, and to Fiona and Lindsay as well. That's really, really helpful. Thank you. Particularly your point about risk, I think, and how different people interpret risk, I think is a really important one, and something that's certainly come up in lots of discussions about volunteering during COVID. So that's really helpful. And I liked your questions at the end. Thank you. I think that'll give us plenty to discuss at the end of the session. So thank you very much. Just a quick check, Véronique, there's no questions for clarification so far, is there? Brilliant. Okay.
No, there isn't. There isn't.
Brilliant, thank you. So we'll carry on. So next we're going to hear from Stephanie Denning. Stephanie's from Coventry University, and her session is titled Being Neighbours During Lockdown. So the experience of volunteering in an outer city estate. So over to you, Stephanie. Thank you.
Thank you. Okay, hopefully that's worked. First, my name is Stephanie Denning, and I'm an assistant professor at the Centre for Trust, Peace and Social Relations at Coventry University. I'm going to be talking today on some research that's part of a wider research project called Life on the Breadline, which is funded by the Economic and Social Research Council. Life on the Breadline is a 3-year project that started in 2018 that is analysing the nature, scope and impact of Christian engagement with UK poverty in the context of austerity. And I'm one of a team of 4 working on the project that's led by Chris Shanahan, also at Coventry. There are 3 main aspects to the Life on the Breadline research. So we've done interviews with national church leaders, an online survey with regional church leaders across the UK, and 6 ethnographic case studies. And today I'm going to be focusing on one of those ethnographic case studies, which is on an outer city estate called the Furs and Bromford Estate, which is in Hodge Hill in Birmingham. And I visited Hodge Hill in person before lockdown when we started the ethnography, but then had to move that online during lockdown. There's 3 themes that I'd like to talk about today. First is asset-based community development. Second is physically distance connecting. And thirdly, challenging stigma. And that's an example of local volunteering during lockdown. So that's one branch of the overall Life on the Breadline aim. Turning first to asset-based community development, or ABCD for short. Asset-based community development is a different approach to volunteering, and its principles come predominantly from the USA, with key figures including John McKnight, Jody Kretzmann and Cormac Russell. So as you may know, the main principles of asset-based community development are to focus on assets and gifts rather than deficits. So it's about what physical and economic resources are found in a community rather than what's not in a community. And it really emphasises the power of local networks and bottom-up change. Hodge Hill Church, the Open Door Community Foundation, and the charity and social enterprise Worth Unlimited worked together to implement asset-based community development on the Firs and Bromford estate. We're going to focus today on the street connectors, which is part of their work on the estate. Now, the street connectors are a group of around 10 people who ordinarily volunteer to go door to door within the estate to connect with their neighbours and to build community. And Claire, who's one of the street connectors, she described their approach to doing this. She said, "That's how we look at people, gifts and skills. It's all over Bromford, and we're the ones who go and find it." So I should also add at this point that the street connectors are a mix of people who are Christian, Muslim, or of no faith or agnostic. So whilst the overall Life on the Breadline project has been about Christian responses, today it's not so much looking at the church response. With the street connectors, I had met them in person and been out with them before lockdown started, and the ethnography then moved online with joining their informal weekly Zoom calls, telephone interviews with 4 of the street connectors, and I ran an online focus group with 4 of the street connectors. The second theme is physically distanced connecting. So in the focus group, street connectors shared photos that they'd taken of their experience of being in their community and on their estate during lockdown. So some of their photos are shared on the next few slides. So on the right-hand side of this slide, we've got the VE Day physically distant street party, which one of the street connectors suggested to people on her street, and then it was quite a spontaneous thing on the day as it grew. You can also see in the middle of that picture, although it is quite small, that there's a very small plum tree growing in her front garden. So Penny, the street connector, who's in the red top on the left, she, along with others in the community, planted a fruit tree in her garden in about March, with the hope that that would mean that local people could pick some fruit, that children could pick plums on their way to school. And when people suggested to her that people might steal the plums, she said, well, actually, that's the point. I want them to take the plums, and that to be something for the community. The photo in the middle and the photo on the left is part of the hot meal deliveries that the street connectors took part in. And that was predominantly to people that were shielding, particularly to older members of the community. So Jo, one of the street connectors that took part in delivering the food, she said, I thought it's so much more than just going and taking food, because this helps my mind as well, and I get to connect with people. And you know, they say it's a hug in a mug. I felt like it's a hug in a crate. So the crate was, because it was physically distanced, they weren't handing the plates of food. And this was hot food that was cooked in advance. But for Jo, she pointed out how it wasn't just about the food itself, but it was about what that represented and about the relationships between people. The street connectors also took part in sharing and swapping of books and jigsaw puzzles to help keep people entertained, and took part in positive messages and drawings that were left on fences and in the nearby Bluebell Woods, which more people visited than usual for their daily exercise. And the woods became a focus for creativity, distance connecting, and sharing positivity during lockdown. So together, these activities for the street connectors were about how physical distancing doesn't mean that you're socially not connected. And that's been even more important as the street connectors have started to go door to door. So they are connecting with people face to face, but being careful with how they're doing that. The third theme is continuing to challenge stigma. So the street connector volunteers continued to work during lockdown to challenge the stereotype of their estate as deprived, and instead to connect people and to focus on each other's gifts. The street connectors shared how the estate had been negatively stigmatised for decades, having been built in the 1950s and 1960s. Statistically, the estate is one of the most deprived areas in the UK. But Claire, one of the street connectors, commented on this. She said, "We're a little council estate, always been known as a council estate, and there's been a stigma about it. But if you stay on the estate and meet people, you'll find absolutely amazing people." So for Claire, it wasn't about the statistic of deprivation, it was about what are the people, who are the people and what are they doing, people that live on the estate. So the experiences that the street connectors shared with me were contrary to assumptions that could be made, for example, in mainstream media, of experiencing lockdown in a tower block and on a statistically deprived estate. And the street connectors were consciously aware of the principles of asset-based community development, and that influenced how they then went about their day-to-day connecting. So just to end, there's two implications that I'd like to draw out. First, that this was very much about a localised approach to volunteering during lockdown. So it's distinct from a national mobilisation of volunteers. It was about neighbour-to-neighbour care and about building relationships over time. And Penny, one of the street connectors, commented on this when she said, 6 months down the line, you'll find that as a result of that conversation, people have been contacted by somebody and are now doing amazing things on the estate. And it's just wonderful to see things growing out of a conversation, one connection that grew. And this was more informal than a time-limited volunteering commitment, as street connecting and being a neighbour spilled into their everyday lives. Finally, just to end, this research has aimed to move beyond the statistics of deprivation to focus on assets in a community and how people can work together and support each other. So a challenge for researchers is perhaps that we can all too easily typify deprived communities and feed into stigmatised narratives. However, it's also important that we don't romanticise people's experiences of volunteering during lockdown. And we also shouldn't ignore that the COVID-19 pandemic has affected people on lower incomes and people of ethnic minorities in the UK more than their counterparts, and the effects of COVID-19 are likely to continue to exacerbate inequalities. So it will be important in policy and practice to actively engage to reduce inequalities, particularly in light of the UK entering into recession, and to listen to people's on-the-ground experiences, concerns and hopes for the future. Thank you.
Brilliant, thank you very much, Stephanie. Really interesting and important points you're making, particularly at the end there. Thank you. Particularly struck by the reminder of the localised nature of volunteering, not just in the pandemic, or particularly kind of now maybe, but kind of generally how localised volunteering often is, and the importance of connection to place in shaping volunteering. So thank you very much for that.
Thank you.
Going to move now on to a session by Beverley Gilbert from the University of Worcester, and Beverley's going to talk to us about the motivations and emotions of volunteers in a sewing club during COVID. So Beverley, over to you. Thank you.
Right, let me just try and get my PowerPoint up. Has that worked?
Yes, that has worked. You just need to click on, yeah.
Lovely.
If you start the slideshow, that's all good.
Thank you.
Brilliant.
Thank you. I'm Beverley Gilbert. I'm a senior lecturer in the Violence Prevention, Trauma and Criminology department at the University of Worcester. And During the early lockdown stages of COVID-19, sewing groups formed in response to the lack of personal protective equipment needed by the NHS and health workers. This issue was mentioned in the local press and the national press quite extensively, as people were experiencing a real level of discomfort in their frontline workplaces, caring for those who were impacted by COVID-19. Some of these groups were known as scrub hubs, and they were regional or national in their formation. But in addition to that, there were lots of smaller groups, community groups, that formed around social media in an effort to do something practical during this situation to alleviate the discomfort. So this was an examination of the motivations and the emotions linked to the formation of a sewing group, a voluntary sewing group formed in Tamworth, Staffordshire, a small, quite ordinary market town in the Midlands. It was a coordinated effort of craftswomen predominantly, helping to ease the discomfort of frontline workers. And I wanted to find out what motivated all of these volunteers to come together. There were 540 at the time of undertaking the research at the end of May. And I wanted to know why people wanted to get involved and what was the emotional connection to the purpose of volunteering. So I devised a JISC online survey, and 99 research participants took part, answering quantitative and qualitative questions. A mixed methods research study, very small, considering the responses of individual research participants within that Tamworth group. So there's relatively little attention paid to community groups and activities. During the immediacy of the lockdown under COVID, these what are termed as under the radar groups came to the fore when responding to risk issues and the need of individual communities, and are important when considered as part of civil society. And these small community-led groups are formed seemingly overnight to address the immediate needs in a swift, responsive way that many more formal organisations weren't able to do or seemed unable to do at the time. So this little piece of research is interesting as it examines the motivations and emotions behind collective action during COVID-19. And it considers the volunteering activities of individuals around this small market town during a period of national and international crisis. So the online questionnaire asked participants about how they'd heard about the group, what their emotions and feelings were about joining the group, why they chose to join, and how they felt in joining. What I found is that 80% of respondents felt that because this was a local Tamworth group, that had been a really vital reason for them joining. Only 20% of questionnaire respondents indicated that the location of the group made no difference to their decision to join. What I found from the research is the emotional connection to the geographic area was fundamentally important and had an impact on the local healthcare workers, local hospitals and local care homes in the area. The volunteers in this group wanted to help the local area. They wanted to see and hear the impact of their joined up actions. An interesting response was when they were asked if they'd had previous voluntary experiences before, whether they themselves had volunteered time or resources to any other voluntary group. 61% of the questionnaire respondents said that they had not previously volunteered in the community at all. And most of those said as a result of the positive emotional impact on themselves of this group, they would volunteer again in the future. So that's quite important when you're looking at the small area of Tamworth. So the main point of the research, looking at examining the emotions and feelings connected with the collective of volunteering. So the research questionnaire aimed to capture some of the emotions and feelings during the pandemic connected to volunteering in this particular group. A time in history, no doubt, that we will look back and reflect upon and research and consider for some generations. So the questionnaire respondents offered comments to this question. Some of them were very lengthy, linked again to feeling that part of the Tamworth community effort. And for many, there was a sense of anger at the political aspects of COVID-19. And others felt a sense of pride, a sense of purpose, and a sense of community cohesion by doing something collectively, some type of volunteering of time, energy, resources to help the NHS and healthcare workers. Some replies indicated a sense of doing something to assist their own mental well-being, their own sense of purpose, and wanting to play their part, however they perceived it as small, in doing something in terms of collective action. Many replies to the questionnaire highlighted that participants enjoyed creating a sense of community, a small micro-community linked to a Facebook page. Appreciation was an emotion that had a significant issue, a significant impact on that sense of community and the continuation of being involved in a group and offering skills and time. This quote, "We're in an extraordinary phase of history, and I felt the need to contribute. I'm disabled and work from home, but I'm also a craftsperson and have the skills to contribute a little by sewing and crocheting items. If we all offer a little bit to community, wouldn't the world be a nicer and safer place? I wanted to feel that I'd done something to support others during this awful time." And this links into the people who did volunteer. 10% of the participants in this research study disclosed that they were disabled. Most of them were over 45 years in age, and the highest age was 80 within this study. And what I found from the research was that people who felt ordinarily that they had nothing to contribute in terms of volunteering and community were able to offer something, able to feel non-disabled or useful in purpose. And I think that's really important when we consider volunteering, to enable everyone to play their part. It's not just about being physically able to wander around to do things physically and present in the community. This particular group allowed people to use their own skills and their time and their disability or ability to contribute to the same purpose. One of the emotions that came to the fore quite frequently was anger. Anger at the government, anger at the lack of PPE equipment, and also anger at the way COVID-19 was being addressed or dealt with. We saw at the time on the media lots of images of NHS staff, care staff, who were either without personal protective equipment, were without some kind of protection when they're carrying out their work, whether that was in care homes, whether that was in the NHS wards. And that in itself raised significant emotions to my research participants.
1 minute, Beverley, thank you.
Thank you. Wow, that's gone quick. Some comments indicated the feeling of pride and a patriotic connection to the purpose of the group. You know, especially in the over 50s. There were comments less about anger and more about rolling up your sleeves to get on with it. Attitudes linked to a sense of patriotism and a link to purpose. There were many respondents who felt that the task they were undertaking at this time for the country and the NHS was reminiscent of being at war. And there were lots of statements reminiscent of supporting people in the front line. People mentioned the home front. People equated their actions as to being like the Land Girls, a group of predominantly women taking on a real significant purpose. Another emotion was linked to anxiety. that was linking to the well-being and health of individual group members. It allowed those older or disabled community members to contribute to volunteering, and that in itself helped them deal with COVID, deal with the sense of isolation and anxiety that they were feeling. So to summarise, it's a small-scale snapshot of a small community action in Tamworth, Staffordshire. The emotional connection to the purpose is vital when choosing to volunteer time and or resources to a community cause. The geographical connection to volunteering was important for my research participants. And the sense of community and mutual purpose might be of particular interest given the social impact, the financial global impact of the pandemic on all communities across the globe. Thank you.
Brilliant, thank you very much, Beverley. Really interesting piece of work. Great to hear about that, and really good to hear more about kind of emotions and feelings within research on volunteering and beyond, which does give me the opportunity to do a shameless plug of a BSSN seminar which is coming up on emotions in voluntary action. So have a look out for that if you haven't already seen that. I think that'll be really fascinating, and it's something which we don't explore enough, I don't think. So thank you very much for that. So I'm going to hand over now to our final speakers, last but certainly not least, Matt Baillie-Smith and Bianca Fadel from Northumbria University, who are going to talk to us about volunteering during COVID and disrupting geographies of voluntary action. And I know that Northumbria has been having all sorts of internet issues, cyber issues, so thank you very much for kind of joining us today, and I hope things kind of go smoothly for you, but shout if there's any issues with technology. Thank you.
Brilliant. Thanks, Angela, and morning, everybody. It's really nice to be here. I should say a quick qualifier at the start to say a particular thank you to Angela for kind of encouraging us to kind of think through what we're about to talk through, and it is very much a thinking through. We're not going to report on a particular project, but some sort of reflections, and that's because both Bianca and I work in global development, and we work on volunteering and humanitarian volunteering in humanitarian development settings. And one of our frustrations has always been that, in a sense, the silos that exist around research on voluntary labour, and that's really come to the fore for us, I think, in the context of COVID-19. And so, really, what this is about is us offering some reflections on perhaps some things we should be thinking about and where we might be getting some additional learning and additional knowledge from. And I suppose our starting point in that, and it was really interesting for me that when you know, the lockdown started and when there was the kind of big push and the kind of mobilising and debate around volunteers, what I suppose was interesting for us is thinking about the work I've been doing around kind of volunteering in crises elsewhere, and thinking a lot of the challenges and debates and confusions and frustrations didn't sound that new. They may be new to many of us in the UK, both as practitioners and policymakers and researchers, but they were echoing lots of different things. And also what I was thinking in that moment was that actually we could be learning an awful lot from our colleagues and peers and volunteers and others within the Global South, particularly within Africa, extensive experience, but also Southeast Asia and elsewhere. So that led to this first kind of thought, that kind of the newness and learning that we talk about in COVID-19, as that brings us, as today, as a group together to think about volunteering, we should be globally situating it, historically situating it. We need to be really careful not to say, wow, this is new, this is interesting. It may be in a particular setting, but are there dialogues we're missing? And the reason I think that's important is that effectively, there simply isn't the volume of research undertaken on volunteering within the Global South that there is in the Global North. And yet, of course, if you think in very pure numerical terms, huge numbers of a huge volume of voluntary labour within the global humanitarian development industry, within communities, within the Global South is enormous. So there's a kind of a disproportionate volume of research, which means we are missing a lot of experiences and knowledge and kind of very rich experiences and ideas, because research has not effectively worked to gather that. And so I suppose I became really worried that actually a lot of the kind of Global South histories and knowledges around volunteering in crises are either kind of silenced or they're kind of ignored as we all start to rush into, you know, we'll all be starting to produce, all of us, I'm sure, special issues on volunteering in COVID, as there are special issues in everything to do with COVID. And I started thinking, well, okay, but let's be really careful we don't write out a lot of things in that process, and don't take advantage of other kinds of knowledges. So there are kind of three sort of areas we wanted to talk about in this. One was around identity, belonging and coping in crises that we've learned from some of the work we've done elsewhere. Some of it was about acting within crises. So what can we learn about people who are volunteering? Not we are volunteering to help something, just that's separate from us, but something that is kind of caught up in our everyday lives and often over very long periods. And then finally, some of the kind of destabilizing we think this suggests around volunteering research. And when I should add the kind of qualifier here, I don't mean academic research, and I don't mean it in academic research in the way that sometimes it's spoken about. I suppose what I'm talking about is the kind of rich bodies of knowledge of how volunteering works, who does it, who manages it, and some of that is by academics, some of it is by practitioners, some of it's by those of us who sort of fall in between. So next slide, please, Bianca. And just to kind of give a quick flavour, we're not going to talk in very focused ways about particular projects, but to kind of give a sense of the kind of range of projects we're doing that sort of got us reflecting back on this. So there's a global review on volunteering, which I did with the Red Cross a few years ago. There's a GCRF project on volunteering in Uganda. There's some collaborations with ASO, with UN and so on. But we're more going to kind of use some of our, I suppose, learning through the three projects on the right. Our COVID story, the Volunteering in Conflicts and Emergencies project, and Bianca's fab research on volunteering in Burundi. And so if you want to find out about any more of those or engage in this, just fire us a message. I think our email is working, going back to Angela's point about things, but maybe just try every means you can. I'm going to hand over to Bianca.
Thank you, Matt. So as Matt has already said, we're going to talk mainly here briefly actually about these three main projects that have actually made us understand the overlaps between different research approaches and different projects that have been done mostly focused on the Global South, but also here also exploring the context of the Global North. So in a few words about methodology, really, all these are qualitative research projects. We're not going to get into details on the methods here, but we're more than happy to answer questions about that later on if there are any. And the focus has been on exploring local experiences of volunteers in contexts of crisis and their agency in those contexts. So you can see here on the slide some of our main research questions. And for the VICE initiative, the Volunteering in Conflicts and Emergencies initiative that started in 2015, volunteers were basically asked, what is it like to be a volunteer here in this context of emergency or crisis? In my own PhD research, I'm looking more specifically at the context of protracted crisis and trying to understand what is the contribution of volunteers to sustainable solutions in their own communities in this context, more specifically looking at the case study of Burundi in East Africa. And then finally, in partnership with the Red Cross and Red Crescent movement, we are looking here at the stories from volunteers that have been currently responding to the COVID-19 crisis and trying to look a bit more into their own perspectives around it. So in this map, you can see that stories have come from many different contexts, 44 countries. There is a predominance, as you can notice, from stories of stories coming from European countries. And that's partly because the project was launched when the pandemic was at its height in Spain and Italy. So you can see and read all these stories on the website here on the screen if you want to go into more depth of any of the specific stories. What we're going to try and do here now, as Matt has said, is look at these three main themes that have come very strongly, and we can see many overlaps between among these different projects. So the first theme is about identity, belonging, and coping in crisis. And what we mean by that is actually that volunteering can foster cultural identity and different forms of belonging, different layers of belonging, not only at the height of a crisis, but also over time. And it can enable then individuals and groups to cope and sustain their livelihoods over time in face of disruptions and different kinds of impacts that we know about. So we're not going to read all these quotes here on the slide. They are bringing more of a context really to what our research has been looking at. But basically, they are all coming from a place where volunteering is seen as the safe space for volunteers to be in the first place. So if we look basically at this idea from the volunteer from Costa Rica, for example, saying that volunteering has helped overcome and deal with the fear that this person was feeling, that relates quite strongly with the approach from this volunteer in Spain, saying that volunteering has brought the opportunity of creating friendship bonds and also, above all, having a good time. And this is also coming from a place of understanding, and that relates to what Stephanie has said in the previous presentation here about the importance of neighbours coming together and understanding the local bonds that are formed. And this is something coming quite strongly from my PhD research in Burundi. When, as you can see here on one of the quotes, someone told me, so even if the help is coming from the president himself, he will never be able to see the smoke of the house that burns, and it is your neighbor that's going to see and warn you. So this is our first, very briefly, our first key thing. And moving to our second one, we are here talking about how volunteers are acting within crisis. So they are not separate from the context of crisis, but they are actually most of the times facing the same levels of vulnerability and fragility as those that they are supporting. So narratives of heroism, as we can see, for example, the World Humanitarian Day campaign from this year, talking about real life heroes for humanitarian workers and volunteers in general. These kinds of narratives, they often come and place volunteers above and beyond risks, and that can actually overshadow these fragilities and needs that we're talking about. So we're not only looking at security and well-being systems, such as the essential provision of PPE and training and insurance, your safety nets, as other colleagues have already mentioned in their presentations earlier today, but we are also talking about safety in this midst of this complex geopolitics of aid, because volunteers are the face of aid, be it adequate or inadequate, and they are often associated with the contentious politics that comes with the provision of aid and help. So from our volunteers participating in the VICE study, we have here the quote saying that, well, I'm helping, but who is helping me? Nobody. The fact that I'm wearing an emblem is not a bulletproof vest. And that relates also to COVID experiences of volunteers. For example, this one from Spain, saying that for the first time, this person has seen fear in people and also among volunteers themselves. So we would like to highlight these as one of our main themes as well. And now I hand it over to Matt for the final one.
1 minute, brilliant.
That's brilliant. Thanks, Bianca. So I suppose the argument we're trying to make is that there are lots of experiences in the South that are kind of predate what we're working through now in understanding COVID-19 in the UK and in Western Europe. And we've heard things from people saying from Spain, saying, oh, I never thought, you know, I'm learning all this stuff. And we've thought, wow, you know, actually, when we've spoken to volunteers in Uganda and Burundi and so on, it's very similar. So we've listed really these kind of key things we've covered around identity and about complex fragilities. And I think this last number 3 on the left is really important, that there is a risk that these kind of multiple and complex fragilities that lots of people have spoken about are ignored in the rush to mobilize cheap labor. And if anyone's interested, we've started trying to explore the relationship between kind of volunteering and kind of vulnerable livelihoods in a paper just out in Voluntas, which should be open access, but I have no faith in anything anymore, so email me if you can't get it. just on the right, I suppose it's all very well saying we can do these things, we need to learn, but there's some quite important work that needs to be done if we want to kind of make these connections around volunteering research. So one is around, there needs to be much greater work around decolonising conceptualisation of volunteering and volunteering policy. So we don't talk about it as if it's from everywhere, because it isn't. Current thinking comes from quite particular places, and we need to be careful about that. I think the second thing is about the kind of equitable partnerships that are built around research on volunteering that goes across international kind of the north-south kind of imaginaries and divides. And then the third one is addressing access to funding and opportunities for research leadership and publication around volunteering that is not endlessly people like me. I think we'll finish with that.
Brilliant.
Thank you very much.
Yeah, thank you both to Matt and Bianca. It's really helpful. I think it's so important that we are learning from what's kind of happening everywhere, and I think certainly the literature that I've been looking at has been kind of drawing on some of the work that you guys have done and beyond, and it's really important that we do that, and we don't do it nearly enough. So thank you very much for that. So we're going to open out now for questions, conversation, discussion across the whole group. So please do use the Q&A function to raise questions for individuals in the panel or for the panel as a whole. I'm going to hand over to Véronique, who's going to lead us through this part of the discussion. So Véronique, are there some questions that you want to put to the panel that are coming from the audience so far?
Yes, there are only a few questions. I'm guessing that a few more will come as we discuss. Some of them have actually been answered, but I think I would pose them again because other people might want to answer. There's a very good question on the connections and how things happen during lockdown, but what does that mean for the future? Tony commented that she had noticed that local connection have reduced after lockdown and people have gone back to keeping to themselves. So Tony writes, I think people connected locally more during daily walks as though they couldn't go shopping, leisure activities further afield. So it's looking at what's happening now. And then there was a really interesting question that has been partly answered that was asked of Geoff, and it was about whether people who used to be really involved in sports activity then went on to do other things when they realised they couldn't get involved with their current volunteering. So it's really quite a few interesting points on the impact of existing connections and new connections, which was also raised for Ellis.
Great, thank you very much. So maybe we'll go around the group to see who wants to comment, but maybe actually if any of you want to respond to those points, then please do put your hand up and we'll do it that way. So Geoff, do you want to go first?
Hello. Yeah, we don't really have evidence that those who were volunteering in sports clubs and weren't able to do that have gone somewhere else. Our strong evidence was that the key volunteers in the sports clubs are very keen to keep the club going and were connected together with each other and did everything they could to do that. You might lose volunteers from sports clubs to the extent that new volunteers are recruited from the parents of kids that take part. And if there's less participation, there'll be less members, there'll be less volunteers coming from that route. In terms of people playing sport, it's a really interesting question, the extent to which people have diverted from playing in their traditional club environment to doing more informal things like walking, jogging and cycling they can do by themselves. And this is a big research question we just don't know the answers to at the moment. We have got we know from surveys there's an increase in this sort of physical activity, but what we don't know is to the extent to which it's people diverted from what they were doing in the club. But of course that's not got much to do with volunteering, that's participation.
Thank you. Others maybe want to answer the kind of broader point around kind of connections, and whether some of the local connections which were really highlighted and kind of came to the fore during the kind of the peak of the crisis, maybe already beginning to shift as people kind of return to work, as they return to school. So I think there was a question there, wasn't there, Véronique, around whether those connections are already beginning to change and whether that will affect volunteering. Stephanie, did you want to come in there?
Yeah, thank you. I think from the street connectors that I've been working with, it's almost as if they kind of had the ideals and were doing the street connecting before lockdown, paused a little bit at the start of lockdown as they literally couldn't go door to door. But now that they can do more, and as maybe the community within the street connectors has strengthened, it's kind of like there's now an explosion of community and of connecting. So as lockdown has eased, I think their activity has increased, and so those connections, they're really keen to keep that energy going. But I think it is also part of a shift of like how you actually do see your neighbours, and what you think is almost the point of your neighbours. Is it just someone that you live next to, or is it someone that you know have a sense of community with? And I think in Hodge Hill on the estate that I've been talking about, that is really a kind of shift in thinking about how you think about living on an estate and being in a community. So that's maybe something that those of us that haven't done that can, I mean, like we haven't where I'm living right now, that we can then reflect on of actually what kind of place do we want to live in? How do we want to view people?
Yeah, thank you. I guess it goes to Beverley's points about kind of emotions and as well, doesn't it, in terms of our feelings about that and about communities and about our kind of position in them. Did anyone else want to come back on those questions before we move on to the next questions? Okay, Véronique, do you want to, is there another question?
There was actually a specific question for Beverley and talking about the experience of people, and Ellie wondered whether there were any tensions around the group in terms of how politicised it was. So the Clap for Carers, for example, ended up dividing people in terms of how the National Health Service is funded or seen.
Thank you for that question. It's a really good one. I think for our group, there were a lot of volunteers who were connected somehow to the NHS. Either they'd recently had surgery or procedures and they were very grateful to the NHS, or they had family members or themselves who were part of healthcare professionals. So the politicisation was just more about anger that the resources weren't there. And as COVID has evolved over the months since I did the research, there's the same amount of people volunteering, but they are diversifying in what they're providing. So as PPE has become more readily available, they're diversifying into other needs, such as premature baby comfort blankets or hats. So they're providing masks to people visiting hospices or that type of thing. So the coordinators are very good in showing their appreciation to the group members, and I think that is keeping any negative emotions at bay at the moment.
Thank you. Actually, Beverley, I do have a second question for you, which I think actually could go to other speakers as well, which is about people's motivations. Did you find that participants, the fact that they could volunteer on their own term as being beneficial to taking part? And do you feel this was key to the success of the sewing groups?
It definitely was, and that's why people with disabilities or age or other aspects of being in their home feeling quite isolated could contribute, and they could contribute different things. So some volunteers contributed materials, wool, knitting needles, fabrics, etc. Others contributed delivering items. So it wasn't just the craftspeople who could volunteer time, resources or skills, and I think that helped the group as well.
And building on that, Rachel was wondering whether the learning from such an initiative, what would be the learning for more formal groups?
I think the learning from the little bit of research that I undertook was that there's a wealth of skills and goodwill in the community, and the emotions and geographical connection for my particular group was fundamentally important. And if that was captured, we would hopefully be able to see more voluntary action in our town of Tamworth. And at the moment, I understand the voluntary numbers are quite low in the town. So I think it's capturing that to take forward, to using that in a productive way moving forward.
Is that something that anyone else would like to kind of comment on as well? Thinking about some of the learning going forward. No? Okay. Véronique.
So there's a question from an anonymous attendee, which we haven't had so far, but I think it's anonymous because they felt it could be controversial. So I'll read out the question. Do you believe that with an increase in a focus on local neighbourhood action and local connection with a sprinkling of patriotism combined with Brexit, this will result in an increase of xenophobia and racism? Big question.
Jurgen, then Matt.
And I thought I'd put myself first in the firing line here. I don't think this is consequential that we have more local involvement and then get racism. But I think what has often been ignored in volunteering research, but what is recognised, sometimes even just as NIMBYism. So communities that are particularly well connected, they have a chance not just to include the ones that they are made up of, but also to exclude. And I think the key study for that one was after Hurricane Katrina. It was the particularly strongly connected communities that managed to keep trailer homes away from their neighborhoods. So they got organized and they just made sure that wouldn't happen. So I guess what I'm saying is that's in my view by no means a sort of a causal link, but I think we need to be conscious of the fact that it can certainly appear.
Thank you, Matt.
Yeah, thanks. I mean, I think there's so many things to say about this, and I can totally understand why it's an anonymous post, because it's really hard to handle. I mean, the first point is, well, we need some evidence to actually assess that, and we need to unpack some of the terms in the question, I think, a little bit, because in a way, there's patriotism and Brexit and all sorts of things that there's a whole set of things going on in there that we need to tread very carefully around. I think one of the first things for me, in kind of my experience, is that those kind of, the local in the broad sense, which is already a fairly challenging concept, the local is not antithetical to being cosmopolitan, to being open-minded and so on. And we need to be really careful not to kind of parochialize some of the things that are going on. I think the second thing for me about that is I did a paper a year or two ago trying to think about how volunteering in a particular place, doesn't really matter where, how someone being a local volunteer in, I don't know, supporting migrants arriving in Greece, what volunteering means in that particular place. What does it mean to be a volunteer? What does it mean to help? The thing that makes that up is made up of lots of different things and influences and stories and histories from all over the place, from migrants within that community, from people's own family biographies, which may have all sorts of connections all over the place that may be rooted in all sorts of cultural diversity and so on. So I think we need to be really, really careful not to kind of separate volunteering off from the kind of cultural milieu that actually everyday life is in, and people are sort of navigating. That's a bit of an intellectual point, I suppose, in a way, but I sort of feel quite strongly that there's quite a lot of connections in that question, and I totally understand where they're coming from. I take great solace from the example of Burundi, actually, where Bianca's PhD is, that the unbelievable growth in numbers of volunteers in Burundi, of kind of local community action, and it started with a community response to supporting arriving migrants from within the region who had nothing to eat and nothing to do, and that community embraced that group and supported them and gave time to do that. And that simply doesn't fit the model. People are, you know, there is a sense of being an insider and outsider. It doesn't always hold. That's not to say it never holds, but I think we need to be careful about the connections we might make.
Thank you. Bianca, Stephanie, did you want to add anything, or anyone else? Beverley, sorry.
I'll just say the research that I undertook, most of the participants were white British. We had one Asian woman and one black woman. But I think what I noticed is the photographs that were coming back from the NHS with all the comfort equipment were from all nationalities. The recipients of the collective effort were from all backgrounds, and I don't think I read anything on Facebook that alluded to that it had to go to a certain section of society. It was just a collective effort. And I guess that volunteering in communities will look different in every single community. Tamworth is, I think it's 98.7% white at the moment, so I would expect the volunteers to be predominantly from that ethnic group. But if you're going to Birmingham or Leicester, or each little collective of volunteering will look very different and be for a different purpose. So I think volunteering, time, effort and skills will look different throughout even the small region of the Midlands, for example.
I think that's so important. It connects to Matt's point, doesn't it, about the importance of remembering how contextualised volunteering is and how multi-layered that context is, both from the individual volunteers' perspective, their individual kind of personal histories and all the different roles that they occupy and identities, but also from the context of the place and the organisations that are interacting within that. And it's how we need to understand all those different kind of multi-layered contexts in order to understand volunteering. Thank you. Other questions, Véronique?
So no new questions, but I think I missed one out for Matt and Bianca from Mike, who was thinking about the learning from the Global South and asking whether Matt and Bianca would draw guidance for volunteering and community action in England, where in the past couple of days COVID-19 has been seen as endemic in deprived communities.
I think if I may add some learning really from these different projects that we have had in the Global South, I think is basically to understand that the dichotomy that is usually very common between the giver and the recipient in these situations, they sort of disappear at the end of the day, because this comes back to the aspect we have just briefly outlined about volunteers also facing the same levels of vulnerability as those that they are supporting. So I think we have been really learning how to overcome these different boxes that we tend to traditionally use when discussing voluntary action, and also the help and the aid as coming from elsewhere, to understand how these local and neighbor efforts that we have been looking at with the mutual aid groups in the UK, for example, they really connect quite strongly with the learning from different contexts in the Global South, as we discussed it, and my own PhD research in Burundi has been a very interesting case study about that, about how much of the resources and the efforts they actually need to come naturally from the groups, and how this is something we need to learn from. Yeah, thanks.
Thank you. Did anyone else want to add that? I think it connects to a question that was asked earlier that I saw around kind of understandings of mutual aid and the discussion that's been kind of trickling or running throughout the whole of the event in terms of what's mutual aid, how does volunteering connect to mutual aid, is this something new? No, it's not something new. So I don't know, any reflections that people have got on that would be interesting to hear as well, I think. Geoff? Oh, you need to unmute yourself.
Yeah, got it. Yeah, that's my response to Mike's point, really. I've always thought of the network of sports clubs as classic mutual aid organisations, because they're basically a cluster of people collecting together around an expressed enthusiasm, whether it's play cricket, football or whatever it is. So they've got a shared enthusiasm they want to facilitate and make happen. And to some extent, they're also a service delivery organisation when they're providing the opportunities for other people to play the sport who are just paying their subs and coming along, more likely kids coming along and playing the sport. My sort of question was to try and relate it to some sort of political theory about anarchism, actually. I think sports clubs are actually, I quite like their sort of anarchistic tendencies because they're very independent of government. We had a lovely quote from research about 20 years ago from a sports club when we were talking about Sport England policy, and they said, well, we've been here since 1890. We've had a lot of government since then and a lot of different policies, but we're still going to be here after the last government. So, and other research has shown that sports clubs have actually got very little knowledge or interest in government policy. So they're sort of fiercely independent of government. They do see themselves as independent organisations, but not in a sense that they want to disrupt government at all, because actually all the volunteers that we interviewed were very keen to do their civic best in a way, to try and do the best thing that they could as a club and act in the best way to try and prevent the spread of the virus, so to speak, to act in a civilly responsible manner.
Thank you.
My colleague might want to say something. Do you want to say anything, Lindsay? You all right with that? Okay.
Okay, thank you. Has one final question popped up, Véronique? We've probably got time for one more if there's...
I think the final question, let me just check. No, the final comment is more comment about the recording of the session. So yes, the sessions are recorded and will be available on the VSSN website. So not a question, Angela, I'm afraid.
Matt, did you want to?
So in response to there not being a question, I've still got an answer, which is a definite sign that I should have been an academic. But going back to Geoff's point, I think something really interesting that is underlying some of that, which is about power. And actually the problem is, well, not the problem, the issue is in a way that there is a power to name certain kinds of practices as certain things by different people, isn't there? And we've really seen that in COVID, of who names what is volunteering, who names what is something else. And certainly in the work we're doing on this big project in Uganda shows that actually a lot of the people we've spoken to are really reluctant to use the language of volunteering, because they feel that the language of volunteering belongs to somebody else. It belongs to UN agencies, it belongs to large donors. They do everyday, informal, getting by, getting on, supporting, neighbourliness and all those kinds of things. And there's almost a sort of sense of, we don't have permission to talk about that as volunteering because we just do it. And so there is a problem in my mind, for me, about the ways in which what volunteering is has been kind of, one might use the word kind of colonised or taken over, or for certain things, and the diversity underneath that is being lost a little bit, and that has real effects on the ground. So I think we need to acknowledge that some people have a lot of power to name what they say is, this is volunteering, we're going to do a voluntary mobilisation. All right, well, you get to name that, but other people talk about other things. I
totally agree. I think that it's so interesting what's happening at the minute in terms of a kind of a valorisation of what can be talked about as volunteering or mutual aids and things now, and how it could, in some ways, it's recognising what many of us have always recognised as volunteering, as being volunteering, and in other ways, there's a risk that people will try and take it over and try to control it and subvert it for different things. So, Jurgen, what did you want to?
Well, given my background, you would expect me to want to say something on that, and I think the key part that I would say is this is partly a linguistic question, and I spent a whole weekend with a Chinese scholar trying to work out what we understand the concepts to be around volunteering in China and in the UK. And so it's not just the sort of the terminology, it is very much about how we find the shared understanding and the shared contextualization. And yesterday I closed on saying, this is a context of crisis, but when in response to Matt here, this has to be based on a shared contextualization, how we understand these terms. And that's why I was also getting a bit stroppy about mutual aid being just used all over the shop. Sorry, that was just me.
Last quick word, Geoff, because you need to finish. So very quick last word. Okay.
Yeah, I mean, someone called Tony has just said we've got a lot of people that volunteer but don't think themselves as volunteers. This is always difficult, researching volunteering in sport. A lot of people just think of themselves as we're part of an organisation where there's almost a moral obligation to chip in and do something to help it, and we don't think of ourselves as labelled as a volunteer, which makes it difficult to survey people when you say, what have you done in terms of volunteering?
Yeah, this is definitely a perpetual kind of issue and topic. I don't think we can ever have a seminar on volunteering without revisiting the question of what exactly is volunteering. And I know that it's sparked lots of debates that we could kind of continue on now for a while, but I will need to end us here. So thank you very much to each of our speakers. Absolutely fascinating presentations, really, really useful to hear those different kind of perspectives and research coming from different angles. So thank you very much to the speakers. Thank you to Véronique for facilitating, and thank you to all of you who are kind of listening and watching for kind of sharing your thoughts and reflections through the chat function and through the Q&A. So the session has been recorded. It will be available on the BSSN website. We'll also kind of save the chat so we can share that if people want to see the comments on the chat that didn't manage to catch up during the session. But have a break now, have lunch. We'll be joining back together for sessions this afternoon if you're able to join us from 2 o'clock. So go and have a good lunch now. I'm sorry we can't see you in person for lunch. That'd be very nice to continue our chats over a bite to eat, but we shall do it remotely. Thank you all very much, and we'll see you soon. Thank you.
Cheers.
See you, Stephanie. Thank you.